So this is not hard. Just imagine you have this young lady, correct parent pay. You are having a difficult time helping her understand what causes your chest tightness, why sometimes you have to use an inhaler. Not to worry, in this video I'm going to tell you how. My name is Tosin. Welcome to my YouTube channel. In this video, we're going to cover 6 basic questions. Number 1, what is asthma? Number 2, we're also going to explore what causes your wheezing, what causes those chest tightness that you experience. Who can get asthma? Which age does it start? At what age does asthma begin? At what age do you begin to experience the symptoms? We're also going to find out, is there a cure? And also, does asthma get worse with age? Coming up. So, in a short way, how do you explain to your friends, your family, your loved ones, and your co-workers? Tell them that asthma is a disease of the airways in the lungs. When there is an exacerbation, the airways in the lungs become red, they become swollen, so they become narrower, so the passages in the airways become narrower, resulting into the symptoms you experience, the chest tightness, the breathlessness, and the discomfort you feel when there is an exacerbation. Sometimes those asthmatic exacerbations are mild and can resolve without treatment, but most times you require treatment to reduce the unpleasant feeling that you experience. No asthma remains the same throughout life. If you stick by your treatment and consistently take charge of your own treatment, you will have some bad days but more pleasant days. But if you leave asthma untreated, it's very likely that there may be complications down the road, and that leads to more bad days than good days. What does inflammation do to your body? Inflammation is what results into all the symptoms you see: wheezing, breathlessness, chest tightness, and also coughing. All of that is caused by inflammation. Inflammation leads to reduced passage of air into the lungs, causing all of the symptoms that you experience. Inflammation does all this by causing, number 1, swelling of the airways, which makes them narrower, tightening of the muscles around the airways, which is called bronchoconstriction, which even further narrows the airways. It also causes the production of excessive mucus, which can plug or block the airways. And sometimes this damage that it's causing may become permanent, especially when they are not resolved as they should be. When the airways have been inflamed for a long time, they become extra sensitive. And this inflammation can also be triggered by viruses, dust, mites, pollen, certain smells or certain fragrances in the air around you. Even stress and smoke. Who gets asthma? Asthma tends to run in families, so you're more likely to have asthma if someone in your family currently does. Children who display or who have allergies like food allergies or eczema when they are young, they have a higher likelihood to develop full-blown asthma as they age. There are a set of people who have subclinical symptoms, but exposure to allergens, to smoke, to pollen, or even sometimes viral infections can upset their balance and they get asthma symptoms. So at what age can asthma start? Asthma can start at any age. Some people do not have their first exacerbation until they're about 6 years of age, and others are quite delayed. They may have that about the age of 10. Some do not have their first symptom until they are adults. It's called adult onset asthma. At whatever age it starts, immediately you notice the symptoms, please see your doctor. You may have a question, what causes asthma? Have you ever heard the word genes load the gun, but the environment pulls the trigger? Yes. So it's usually a mixture of hereditary, that your genes is transferred by someone in your family to you, and it usually would be triggered by environmental factors. So it's you being exposed to pollen, or it's you being exposed to smoke, or someone who smokes in your family, or smokes around children, or any of those allergens that you are particularly sensitive to can trigger your own episodes. Asthma is a chronic disease that can have acute or chronic exacerbations, meaning that asthma doesn't resolve because you have used your reliever, or doesn't go away because you used an antibiotic. No. In fact, antibiotics do not cure asthma. It's not a bacterial disease, it's not a viral infection, it is a disease of inflammation. Okay? So do not take antibiotics because you think that it will cure your asthma. But if you have a prescription for an antibiotic, your doctor may suspect that there is a bacterial underlying infection that's causing your current exacerbation. Now on to our last question. Is there a risk that your asthma may get worse with age? Yes. If you stick by recommended therapy, you can get asthma under control, and over the course of your life, you can either outgrow it. Some people are fortunate to have that, or sometimes you have it under control for life. There are times when you have your asthma under control for many years, and then suddenly you get some hypersensitivity again. What it requires is you working again with your healthcare provider to be sure that you can identify your triggers and then bring it back under control. But if you do not even begin to treat your asthma or put it under control, then unfortunately it will get worse with age. Most doctors or most specialists, including pharmacists, believe that regular use of preventive medicines will give you long-term protection. So it means that people who use preventive medicines for longer tend to have a better course over their lifetime than those who do not, or those who rely only on relief medicines. So far in this video we've covered what is asthma, we've covered what inflammation is and why you experience the symptoms that you experience. We've covered who can get asthma. We've also covered at what age do people get asthma. We've covered questions about cure, and we have covered the question, will my asthma get worse with age? The next video contains more tips and tricks to ensure that you live a better life in spite of your asthma. Please, if you have gotten value from this video, like it, share it, and subscribe. Turn on post notification if you were impressed. I will see you in my next video. Thank you.